In continuation to the lecture series on a thorough perception on liquid dosage form of the pharmaceutics module under pharmaceutical sciences, today the lecture would be on biphasic liquid dosage form suspensions. I am Dr. Hema Chaudhary from K.R. Mangalam University. As already discussed in my previous lecture, Introduction to biphasic liquid dosage forms, we had discussed the classification of biphasic liquid dosage form into liquid in liquid type and solid in liquid type. Continuing with the solid in liquid type, our emphasis was on oral preparations which covered suspensions. So today's lecture would be an elaborate discussion on suspension dosage form. As already defined, suspensions are mixtures, in other words, or they are also referred as biphasic liquid preparations, which are thermodynamically unstable liquid systems having an insoluble drug which is generally distributed uniformly in the liquid phase. In order to formulate a suspension, the inclusion of a physical stabilizer such as a suspending agent is utmost important. In my last lecture, we had emphasized on what are the various advantages of suspensions, as well as we had touched the disadvantages of suspensions. Talking about the classification, in my last lecture series, we had introduced the types of classification system based on particle size, density of solids, especially when solids either could be of nature of diffusible type or indiffusible type, and third classification based on arrangement of suspended phase, and fourth based on route of administration. Talking about the formulation strategy or the preparation of suspension, it is very important to note that preparation of suspension is a highly skilled job. In order to prepare a stable suspension dosage form, one has to select the ingredients which are based on the nature of the drug and the type of suspension. In other words, the insoluble drug which is to be incorporated into suspension, the nature should be very clear whether it is of diffusible type or indiffusible type, and whether the suspension is intended for oral or external use. If we are desiring an indiffusible solid to be prepared in a suspension dosage form, then selection of a thickening agent is a must. A flocculating agent are also added in case it is desired to prepare a flocculated suspension. If it is a suspension meant for internal use, the utmost important thing is it should be aqueous based. In other terms, the dispersion medium should be aqueous. If it is a suspension intended other than aqueous, then the liquid phase can be aqueous, non-aqueous or hydroalcoholic. As already discussed that how the selection of drug has to be done, one has to remember that in order to prepare a suspension dosage form, the drug should be insoluble solid. And talking about the various additives which go in the formulation of suspension, we have already covered vehicle, wetting agent and suspending agents, flocculating agents, density modifiers, preservatives and organoleptic additives. So in continuation to the formulation strategy, the most important part is compounding of suspensions. If we are compounding a suspension having a diffusible solid, as already mentioned, a diffusible solid is a solid which has lighter density and has good wettability or wetting property. If such a drug is to be formulated into a suspension dosage form, the particular indiffusible solid should be mixed with other solid additives of the formula by doubling up method so as to have uniform distribution, and the mixture has to be levigated with a small amount of the vehicle in order to form a smooth paste. Once the smooth paste is formed, the other soluble additives are dissolved in a vehicle, in a beaker, and this liquid phase is added to the smooth paste in small amounts with continuous trituration. The trituration is emphasized in order to prevent any lump formation and also to help in escape of interparticular air which would be entrapped. Then the dispersion is poured into a tiered container, and finally the volume is adjusted in the final container by rinsing the mortar. if it is an indiffusible solid, then one has to remember that in addition to the formulation ingredient, the most important ingredient be a suspending agent. So initially the procedure covers that the suspending agent, which is in dry form, or sometimes it could also be in a mucilage form like gum tragacanth mucilage. In such a case, the suspending agent is diluted with little vehicle in order to form a smooth paste. Then the remaining procedure is similar to the one which we have discussed with diffusible solids. And the final volume adjustment is made with the vehicle, and the dispersion is strained into the final container in order to remove any foreign particle. The final volume is made up by rinsing the mortar and pestle and transferring it into the bottle. Talking about the container which is to be selected for a suspension dosage form, if it is for an oral use, then the suspension formulation should be packed in a screw capped bottle or an amber glass bottle. Now the logic of using an amber glass bottle in context of suspension is to have good acceptability, because depending upon the type of suspension, whether a flocculated or deflocculated type, it is always advisable that the suspensions are packed in amber colored bottles. And if the preparation of suspension is intended for use other than oral, then in that context fluted bottles are the containers of choice. Suspension dosage forms are generally recommended to be stored in cool place. It should be taken care that they are not stored in refrigerator. On a suspension dosage form, the label should have the auxiliary condition: shake well before use. And finally, the patient counseling should be given that the patient is instructed to shake the bottle before use during storage period so that uniform dose measurement is possible. Now, as we are talking about the preparation of suspension, it is also important to understand the suspension could be either of a flocculated type or deflocculated type. Talking about a flocculated suspension, first and foremost, as already mentioned, in general, suspensions are biphasic. So, suspension system has two phases, one being referred as the disperse phase and the other as the dispersion medium. If it is in context of a flocculated suspension, the disperse phase is generally, which is the insoluble solid distributed either as an individual solid particle or it may be in the form of loose groups. Whereas in case of deflocculated, it will generally be distributed uniformly. In case of flocculated suspension, the floccules are loosely bound. So on storage, the particles which are dispersed come closer to form loose floccules, and they are forming floccules because they help in making an open type of structure where individual dispersed particle will possess too high interparticle attraction, which is comparatively low, and the aggregates which are formed will not have strong repulsion forces. So here the best classical example which can be mentioned for flocculated suspension is milk of magnesia. On the contrary, in case of deflocculated suspension, the sediment formed by individual particle or aggregate becomes very closely packed, and this closely packed aggregation becomes difficult to redisperse. Such deflocculated suspensions are generally corrected by using flocculating agent or by using structured vehicles. Here the classical example one can quote is of calamine lotion. So in simple terminology, if one has to identify the type of suspension to be either flocculated or deflocculated, it is very clear that in case of flocculated systems, the particles are uniformly dispersed initially, and on shaking they redisperse very easily. But on standing, because the particles are dispersed, they have tendency to come close together due to Brownian motion, and because of this close aggregation, the structure which is formed will be a loose network, and the particles will be redispersed on gentle shaking. Whereas on the contrary, if we need to understand in simple terminology deflocculated suspensions, these are the systems which are generally prepared by dispersing uniformly the insoluble solid drug, and on storage these particles come very close and form a strong cake. In other words, these are the particles which, though they settle slowly, but once they settle, they do not redisperse easily even on shaking. So correction in case of flocculated suspension is to shake the system just before use in order to ensure uniform redistribution, whereas in case of deflocculated suspensions, the correction is that during formulation one has to incorporate a flocculating agent and or you have to use a structured vehicle. Now the last part under this particular topic of suspension is talking with respect to its stability aspects. It covers what are the stability challenges when we talk in context of suspensions and what are the various methods to overcome it. Before looking into the stability problems, one has to remember what is the demand of a stable suspension. So in other words, it could be portrayed as the characteristics of an ideal suspension. Ideally, a suspension should have uniform distribution of mono-sized particles. It is very important to note here that the insoluble drug has to be size reduced and each mono-sized particle, generally in the range of 2 to 5 micrometer is preferred, has to be distributed in the dispersion medium, and this has to be uniform. Second characteristic of an ideal suspension is settling of particles should be slow and it should redisperse easily. So though the particle is dispersed, it is not into a clear solution. The settling of such particles should be a very gradual phenomenon, and even if it is settling, the settling will help in forming aggregates, and this network should be an open type. To mean to say that on gentle shaking, the system should go back into its uniform state of redistribution, and this transition should be easy. Ideally, the suspended drug should remain in the suspended form long enough so that after shaking, even on redispersion, the drug should be remaining in disperse phase as uniformly dispersed moieties so that dose is measured accurately. This is very important aspect to note that when a dose is measured out of the bottle in context of suspension dosage form, the ideal characteristic of the system should be that it should look like a uniform distribution or a dispersion wherein dose measurement accuracy is maintained. The next ideal characteristic is in context of the particle size. Since the particle or the drug which is under consideration is insoluble in nature, its particle size should be kept fairly small and fairly constant so that you get a stable suspension throughout the shelf life of the product. And the last consideration with respect to system which need to be stable is its viscosity. The viscosity of preparation is a very critical role because this will make the suspension stable on one side by reducing the rate of settling, and also on the contrary, one has to remember that too viscous preparations would become challenging for its pourability property. As it is under liquid dosage form, a right balance has to be maintained in context of viscosity, which will help in accurate dose measurement and its easy pourability from the container, and also helping in maintain good stability of the preparation. After having understood the qualities of an ideal suspension or a stable suspension, now it is also very important to understand that how this stable suspension can be prepared or achieved. We have understood how a suspension is to be prepared. Now the next challenge is how to keep the system stable during its shelf life. So in order to make a prepared suspension chemically and physically stable, one has to look into the following aspects. First and foremost, the aspect of consideration is what is going to be the settling or the sedimentation rate of the suspended particles. So, the formulation chemist has to first understand the sedimentation rate of the preparation. Second is, we need to talk in context of what are the limitations of Stokes' law. Third criteria to be understood is whether the sedimentation which we are talking is in context of flocculated systems or deflocculated systems. Next aspect is in context of how to overcome flocculation problem or deflocculation problem by a concept of controlled flocculation approach. The next aspect in order to govern the stability of a suspension dosage form is with respect to what is going to be the effect of particle size on suspension stability. The next aspect which we will be covering will be with respect to crystal growth in suspension formulation during its shelf life. And finally, the discussion will be on use of structured vehicles in the formulation of suspension dosage form. Having understood the various factors which will govern the stability of the suspension dosage form, it is now desired to understand each factor in detail. The first aspect, as mentioned, is in context of the stability is governed by the sedimentation rate of the suspended particle. Now, sedimentation in a very general terminology is nothing but how much time the particles take to settle down in the container is referred as sedimentation. So, sedimentation rate refers to the speed. So, the time taken with respect to the settling of particles in a suspension is governed by number of factors such as particle size of the dispersed phase, density of the particle, density of the vehicle, in other words, it is the density of the dispersion medium and viscosity of the vehicle. So, in order to understand what is the relationship of all these four factors which we just mentioned, whether be particle size, viscosity, density of dispersed phase or density of the dispersion medium, the relationship is generally drawn by drawing the clarity with respect to what is the velocity of sedimentation of particles. The velocity refers to what is the speed at which dispersed particle is settling down. It also depends upon what is the diameter of the particle. So, bigger the particle size, faster will be the settling. And what is the influence of gravity, that is acceleration due to gravity, and of course, as we mentioned, what is the role of density of the suspended particle, and also important to note is what is the difference of density between the suspended particle and the dispersion medium. So, in order to understand very clearly the relationship between all these factors, whether be the size in context of diameter of the particle, whether be velocity, because velocity will be based on viscosity of the system, and the density of individual phase, dispersed phase or the dispersion phase, and also the difference of the density between dispersed phase and the dispersion medium. All these factors are brought together by one equation which is referred as Stokes equation. So, to put it across in a very simple way, the rate of settling or the rate of sedimentation of a suspension can be described by Stokes' law or Stokes equation. The equation states that capital V is equal to d square into rho 1 minus rho 2 into g divided by 18 eta, where the V represents terminal velocity of a spherical particle. So, since velocity is nothing but the rate of settling, we are trying to understand that what is the speed or the rate of settling, and this is given by that it is directly proportional to diameter of the particle. It is also related to difference of density of the dispersed phase represented as rho 1 and the dispersion medium represented as rho 2, and it is also influenced directly by the acceleration due to gravity. So, which is in direct proportionality and they are placed in the numerator, whereas it is inversely related to viscosity. So, velocity is inversely related to viscosity of the dispersion medium, which goes in the denominator, as it is to be understood that higher the viscosity, lesser will be the rate of settling. But as I already mentioned, higher the viscosity should not be the only criteria of acceptance, because higher the viscosity, although the lower rate of settling, but porability also is a factor which is directly related to viscosity of the dispersion medium. Having understood Stokes' law or the rate of settling, how it is governed, the rate of settling is directly proportional to diameter of the suspended particle. So, it is very important that in pre-formulation studies, while designing a suspension dosage form, one has to optimize the correct particle size, because the particle size will have a direct relationship with the stability of the system. But at the same time, it is important to note that it should not be a blind approach where reducing the particle size is the always the right approach or the answer in order to reduce the settling property or in order to bring settling rate to a minimum. Because as already mentioned in my initial lecture on suspension dosage form, I have emphasized that if the size is reduced below the optimized size, it may bring in more problems, such as the drug may bring in change in its individual physico-chemical property. Now, when a drug's physico-chemical property will change, it may show lot of changes chemically, or it may show degradation, also a possibility on long storage, because when the particle size goes on reducing, its surface free energy goes on increasing. So, when surface free energy is more, its interaction becomes higher and aggregation or lump formation of the dispersed phase will increase. So, it is very important to note here a balance of size is important. One side we mentioned that the size should be smaller in order to have a stable suspension, but at the same time the size should not be very fine or micronized so that it brings in additional challenges in the formulation. Ideally, the particle size should be maintained in the range of 2 to 5 micrometer, because this is the range wherein although there is a Brownian movement of particles, it will be at a comparatively slower rate, and this will impact the rate of settling, of course, but it will be to a lesser extent. From Stokes' law, it is very obvious to understand that the suspended phase or the dispersed phase and the dispersion medium density should be almost equal, that is rho 1 and rho 2. The difference of density should be negligible. If the density difference is more, then the rate of settling is going to be more. So, since it is a direct proportionality relationship, it is very important to understand that all the excipients chosen for the formulation of the suspension dosage form, the density factor should be taken care of, that all the ingredients should have nearing density to each other. Generally, the drugs which are the pharmaceutical powders or the insoluble powders, which are the active ingredient in the suspension dosage form, fall with a density range of either 1.1 to 1.5 gram per centimeter square. It is a very generalized statement to mention that all pharmaceutical drugs generally in solid form have a density in this range. So, when we are having an ease of having a lower or a narrower density range of different solid drugs, it is becoming very important that some adjustments can be done by right selection of the dispersion medium. If we need to tailor or alter the density of the system, then right thought process should be put into the selection of the dispersion medium. Vehicles such as syrup IP, which is a flavored and a sweetened vehicle, which is a vehicle of choice, generally has a density of 1.31 gram per centimeter square, and the second choice could be sorbitol solution having a density of 1.29 gram per centimeter square are the solvents of choice. And also sometimes they are solvents as such in the formulation dosage form, and the reason of selecting such a vehicle is not only as the dispersion medium but also due to its ease of adjusting the density difference with the solid drug which is under study or which is having been selected to formulate as a suspension dosage form. So actually formulation designing of suspension dosage form is a highly skilled job. So the chemist while formulating should bear in mind these technicalities so that the right selection of ingredients is done while formulation. As per Stokes' law, it is very clear that once the viscosity is increased of the dispersion or the external phase, it will help in reducing the rate of sedimentation. So as already we saw in the mathematical equation of Stokes' law that V is inversely proportional to eta, and it is inverse relation. So one side increasing the viscosity will help in reducing the rate of sedimentation. So this is very important aspect, that this is one more difference one should remember, that in case of mixtures they are more liquid in nature or less viscous in nature, whereas as compared to suspension dosage form the continuous phase or the external phase can be considered in a way that its viscosity becomes a governing parameter in order to increase the shelf life of the product by decreasing the rate of settling. One more criteria which the Stokes' law covers is how the sedimentation rate can be reduced, or of course by using viscosity enhancement agents. So that can also be brought about by incorporating suspending agents. Now the suspending agents sometimes contribute to reduce the sedimentation by increasing the viscosity, and also at times the viscosity of preparation can be reduced by adding suitable thickening agents, but a balance has to be maintained with the pourability and bioavailability of the product. Thank you.